Good afternoon. My name is Dr. Sahil Garg. I'm working as a consultant nephrologist and transplant physician at Amritdhara My Hospital, Karnal. We are here to discuss about chronic kidney disease today and its classical symptom and what patients should not ignore. As we already know that CKD is a silent disease and we get all those symptoms in the advanced stages itself. So let's start with what is chronic kidney disease. So chronic kidney disease affects approximately 11% of adults worldwide and 15.7% of the Indian population. And it's a chronic condition where the kidney gradually loses their ability to function effectively. According to KDIGO 2024, it is defined as abnormality in the kidney structure or function with health implications present for at least 3 months, and it is identified by markers of kidney damage such as urine sediment abnormalities, hematuria, electrolyte imbalances, histological or imaging abnormalities, and history of kidney transplantation or a decreased estimated glomerular filtration rate of less than 60 ml per minute per body surface area. It can adversely affect our overall health, and to diagnose it, healthcare provider uses a blood test to check eGFR and creatinine values and a urine test to check for any albumin in the urine. So yeah, once CKD is diagnosed, the next step is to determine its stage. So basically there are 5 stages of kidney disease, chronic kidney disease, in which it is divided based on the eGFR. In CKD stage 1, the GFR is more than 90. In stage 2, the GFR is between 60 to 89. And in CKD stage 3A, kidney function decreases mildly to moderately with a GFR between 45 and 59. While CKD stage B, the GFR is almost around between 30 and 44. And CKD4, the GFR is around between 15 and 29, while the CKD5, which we call as end stage also, so GFR goes down below 15 milliliters per minute per body surface area. So it can manifest in various ways, and it is important to recognize the symptoms early, as the symptoms are usually vague. So I'm going to tell you about some classical symptoms. So first of all, it's fatigue, like weakness, like shortness of breath on exertion or inability to do heavy work. Swelling, especially noticeable in the ankle, feet or hands. It is because of fluid accumulation, and also there can be early morning periorbital puffiness. As I have already mentioned that CKD often goes is a silent disease, so it often goes undetected in early stages due to a symptomatic nature and non-specific symptoms like fatigue, swelling, and changes in urination, which can be attributed to other factors. So the gradual onset of CKD allows patient to adapt with mild symptoms without recognizing their seriousness, contributing to delayed diagnosis. Lack of awareness about CKD symptoms further hinders early detection and timely intervention. And additionally, CKD symptoms can be masked by other chronic conditions such as diabetes, hypertension, leading to underdiagnosis until the disease progresses in the extreme of these stages. It can lead to serious complications like cardiovascular disease, anemia, bone mineral disorders, electrolyte imbalance like increase in the potassium levels or increase in the acid level in the body, fluid retention, increase in the risk of infection, and sleep problems. So to manage chronic kidney disease and to reduce the risk of complication, here are some essential steps that you can take or the society can take. So first of all, and the most important is regular monitoring. So check eGFR and albuminuria annually for all patients, more frequently for those at higher risk, like diabetic patient, hypertensive patient, or patient having genetic kidney disease, to keep a check on the blood pressure and blood glucose level and use of appropriate medication and monitor the medication regularly. Management of the anemia and electrolyte imbalances, addressing the bone health issue like bone and mineral diseases are very common in chronic kidney disease. So use of phosphate binder, vitamin D supplements to manage mineral balances. Lifestyle changes which include regular exercises, smoking cessation, and a balanced diet. And the education to the patient so that we can provide adequate information to the patient about its chronicity and prolonged effects. And in advanced cases, considering dialysis or kidney transplant to maintain health and quality of life. According to KDIGO 2024 guidelines, EGFR and albuminuria should be monitored at least annually once CKD is diagnosed. For high-risk patient, it can be checked at least twice a year. So now, why this monitoring is so essential? So let's find out about it. So regular symptoms check plays a crucial role in CKD management. Here is how. So early detection of the progression. So if we do regular symptom check, it enables early detection of the disease progression, as the progression often goes silently, especially in the early stages when symptoms may not be noticeable. So by monitoring symptoms regularly, changes in kidney function can be detected early, allowing for timely intervention and management of those symptoms. And secondly, prevention of complication like fatigue, swelling, change in urination. It can help in preventing condition called fluid overload, electrolyte imbalances, and anemia. It also helps in adjustment of treatment plans, like if a patient has high blood pressure or protein in the urine or declining kidney function, he may require medication adjustment as well as lifestyle modifications. So regular symptom check provides the information needed to tailor the treatment plans effectively. It also helps in improving the quality of life, and the most importantly, it prepares the patient for advanced stages of the kidney disease in which he may require dialysis or kidney transplant. Lastly, regular symptom check play a crucial role in CKD management by enabling earlier detection, preventing complications, optimizing treatment plans, improving quality of life, empowering patient, and preparing for future care needs. Make sure to stay proactive and work closely with your healthcare team to manage CKD effectively. Thank you.